Hey Mr. Smith, how are you?
I'm good, thanks. How are you?
Not bad. My name's Nicholas. I'm going to be a physiotherapist today. I'm a first year student at Charles Sturt University. So why don't you tell me a bit about why you've come in to see me today?
Well, over the past couple months, I've been feeling some pain in my right knee while
Yeah.
playing lawn bowls.
Okay. Is there any specific activity in the lawn bowls that might cause the pain?
Yeah, it's the lunging that I have to do to.
Okay. So when you're bending that knee?
Yeah.
Right. And when you're doing that activity, what would the pain be out of 10? So if you had 0 would be no pain at all and 10's the worst pain imaginable, whereabouts would that be?
I'd say it'd be like around 5 or 6, yeah.
Okay, so it's a decent amount of pain.
Yeah.
And when you're sitting here just now resting, is that?
It's only like a 2 to 3.
Okay.
Yeah.
So is there any activities other than the lawn bowls that cause the pain for you?
Walking up the stairs.
Okay.
It's a bit of a hassle, yeah.
Do you have a lot of stairs at home, do you?
Yeah.
Okay. And you have to go up them?
Yeah, my bedroom's upstairs.
Okay, right. And is that a similar pain from when you're doing the lunges?
Yeah.
It would be on the pain scale similar?
5 or 6.
5
yeah.
or 6 again?
Yeah.
Okay. Yeah, right. So basically what we're going to do today is we're going to do an active range of motion test. So what that is, I'm going to get you to lie down on the bed. Do you have any trouble lying down on the bed, sir?
I can't lie on my side. I've got a pacemaker.
A pacemaker, okay.
Yeah, so just on my side.
Okay. So we'll get you to lie on your stomach for the assessment. But what we're going to do is I'm going to get you to lie down on your stomach and we're going to see how well you can bring your leg to your bottom. I'm going to show you how to do that when we're lying down, but it's important that we do that so I can see the degrees and range of motion that you can go through with that.
Yeah.
To do that assessment, we're going to use a thing called a goniometer. That's just going to give us an exact measurement of degrees of how far that joint can actually move.
Yeah.
We'll do it on the good leg first, just so you can see how it is, the assessment works, and also so I can compare it to the bad thing. There are a couple of benefits and risks with this. Just want to make sure you understand. So it's a very beneficial assessment because it helps me narrow down what might be causing the pain or limiting movement.
Yeah.
And it's also important because by doing this assessment, if we continue a treatment plan, I can then do it later on in the treatment plan to see if the treatment's working or not.
Yeah.
So there are a couple of risks with this. You may feel a little bit of pain or tension when we're doing this. And if you do, I want you to tell me to stop straight away. Is that all good?
Yeah, that's perfect.
Okay. So do you understand everything I've said so far?
Yeah.
And do I have consent to do this assessment on you?
Yes.
Yeah. Do you have any questions for me?
No.
No, brilliant. Okay. So I'll just check the bread breaks. So do you work for a living or?
No, I'm retired.
You're retired, awesome.
Yeah.
Plenty of time for lawn bowls then.
Yeah, exactly.
So I'll just wash my hands and I'll go and grab the goniometer. Okay. So this is what I was talking about before with the goniometer. It's just going to lie against your leg like this and I'm going to bring it up. Does that make sense?
Yeah.
Okay, so what I might ask you to do now is just lie face down on the bed for me. I'll move this out of the way for you. Just in your own time, lie down on the bed. Like I said, we're going to do the good limb first. Okay. Are you comfortable?
Yeah.
Okay, so I'm just going to bring the bed breaks up, the bed up. Might ask you if you can just bring your arms to your side for you.
Yeah, of course.
Thank you, appreciate that. You feeling comfortable?
Yeah.
No worries. Okay. So I'm just going to kneel down now and make sure I straighten this leg. Just to remind you, this is the motion we're going to do. We're going to bring our foot to our bottom. Perfect. Okay, so when you're ready, I just want you to do that yourself. Brilliant. And just stopping there and bringing it back down for me. Okay, so that one was 122 degrees range of motion. We'll just do it one more time for reliability. Okay, and back down. So that one was 124. Okay, so I'm going to move over to your affected limb now.
Yeah.
And I want you to tell me to stop if you feel at any point feel pain. Is that alright with you?
Yeah, that's perfect.
Yeah, okay. How did that feel on the good limb?
It's alright, yeah. No pain.
No pain or anything? It felt normal? Okay, so I'm just lining it up. And just to remind you that this is the muscle activation we're going to bring our leg back like that. Okay. So I'm lining up the goniometer. Okay. And when you're ready, I'd like you to go.
Just there.
Just there? Okay, bring it back down for me. Don't want to cause any pain. So that one was 91 degrees range of motion. We'll just do it one more time for you.
Yeah, just there again.
Just there again? Okay. Bring it back down. Alright, just stay there for a second. I'm going to bring the bed down. And when you're ready to, I'll just ask you to sit on the side of the bed for me. Great. Okay, so how did that feel there?
Like the right one hurt a bit.
The right one hurt?
Yeah.
So when you got to that range of motion, when you had to stop, is that when you started feeling pain?
Yeah, just then.
Okay. So basically when we've done this assessment, we found that your left leg's very normal range of motion. You can get to up to 122 degrees range of motion. But on your right leg, when we did it, you got 91 and 90 degrees range of motion, and that's severely affected compared to the other leg. And we want to be able to get it to that 120 degrees or so that you are on the other leg,
Yeah.
which is considered a normal range of motion. So what we're going to do now is we're going to do a couple more assessments just to make sure we understand the injury a little bit better, and then we'll start on our treatment plan.
Perfect.
Perfect, okay.
Thank you.